A new peer-reviewed case report just dropped titled Ketogenic Metabolic Therapy for Schizoaffective Disorder, a retrospective case series of psychotic symptom remission and mood recovery. And while this is super exciting on its own, it's additionally exciting because it's actually documenting my recovery. I am one of the 2 cases detailed in this case report. A team of clinicians and researchers wrote this report, but the lead author was actually Nicole Laurent, who, if you've been following our channel over the last year, you'll be familiar with her as my keto coach, who really helped me to implement ketogenic therapy and, provide a lot of education and guidance around how to do it in the most effective way. Nicole is a licensed mental health counselor who helps people use ketogenic dietary therapy as a treatment for mental illness and neurological issues. You can find out more about her work on her website, mentalhealthketo.com, which we'll link to in the description below as well. So I'm really excited to have had the opportunity to sit down with Nicole to share more information about this case report and what it could mean for the future of psychiatry. All right, so thank you so much, Nicole, for joining us today. I'm sure people have seen a lot of you throughout the last year on our channel, and I've talked so much about how crucial you've been in terms of helping me implement ketogenic therapy over the last year. And so really excited that we're having a dedicated interview with you now. But could you maybe just briefly introduce yourself and your work in ketogenic and metabolic therapy practice?
Yeah, I'm a licensed mental health counselor in Washington State. And I have been in private practice as a counselor for 17 years, I think now. And the last probably 8 years, I have been using my psychotherapy skills to assist people in implementing a ketogenic diet. So in the beginning, I would assist people with the behavioral and emotional aspects, but then I went back and I got training in how to actually initiate and monitor the diet with people additionally. And so outside of Washington State, I do private consultation for people from all over the world for this only purpose. This is my whole practice now.
Amazing. Yeah. I'm glad you mentioned that too, because I think a lot of people think that they need to find a keto coach or someone with experience in this where they live, but it's good to kind of let people know that, no, it can be remote as well too. Yeah. You're my keto coach and we live in different countries even. Yeah.
Mm-hmm. Yeah.
But I want to talk more specifically about this case series that you just wrote as well. And so I guess to start off with, what inspired you to publish this case series?
Well, this case series, this is one of many case studies that I have that I'm publishing or published. Because we're seeing such great results, such great, beautiful recovery stories in individuals who are using ketogenic diets as a treatment for mental illness. So what inspires me is helping to build the research base for ketogenic diets as a metabolic psychiatry intervention. And I'm also very inspired getting to watch people thrive who thought they weren't going to be able to.
Yeah. I mean, this case series features 2 individuals, and I am one of them, but it was amazing getting to read more information about the other person's experience of healing as well. Mm-hmm. And so I guess maybe for people who haven't read it yet, can you maybe share what were the most significant findings in this case study?
Yeah, so a case study, its whole purpose is to kind of round out the research literature. And so, of course, the findings are not generalizable to a larger population, but the findings that the continuity between the 2 cases were really kind of surprising. Not surprising to me, but probably surprising to readers, because you'll notice some real similarities in terms of potentially how long it took for psychotic symptoms to decrease and go away. Another thing that's really beautiful about this case series is that there's a long follow-up period, so a 6-month and a 1-year follow-up. And these individuals had maintained their recovery and their stability. And so those are kind of the 2 big ones that I think are really important, and I think that people will enjoy reading. And also that you and the other individual that were in this case study, or this case series, they were able to either titrate off their medications or were in the process of titrating down off their medications. And it was really interesting also because the treatment team, so both of these individuals These were people who recovered not as part of a study, and these were not people who recovered because they went on a ketogenic diet in order to lose weight and then just, were gobsmacked with recovery being an option and feeling better. But these are people who sought out ketogenic metabolic therapy specifically as a treatment for mental illness for schizoaffective disorder, with the intention of seeing what treatment effects they could get. And there's also similarity in that each of these individuals had different treatment teams. I was initiating and managing the diet, but I was just part of a treatment team that they had pulled together in different areas of the world. One was, where they came from. You're in Canada, but I can't talk about the other one. And so these are successes that have happened outside of kind of the normal medical establishment around how we imagine these treatments are going to take place or how they're going to be available. These are people who pulled together their own treatment teams, and they were successful with just one ketogenic professional helping them learn to self-advocate and guide the process.
Yeah, I think that's really cool in terms of improving accessibility, I guess, in terms of not having to have necessarily a completely dedicated team of professionals well-versed in ketogenic therapies, but figuring out how to make it work within the existing care teams that you have.
Yeah.
So that was cool to see. I guess, why do you think that ketogenic and metabolic therapies led to full remission? Was it full remission in both cases?
Yes, they met criteria for full remission in both cases. And one of the limitations of this case series is that neither of the individuals had disclosed any type of formal psychotic symptom assessment. So psychiatrists have available to them these assessments that they use to measure psychotic symptom and severity. And so we didn't have any of that. But a lot of those assessments rely quite heavily on patient report and family report. And all both treatment teams agreed that this person was in remission. And so family, treatment team members, and the individual themselves identified as recovered. And so that was really wonderful as well.
Yeah. Was there anything that you were surprised about by any of the results of either of these case reports, or is it pretty consistent with others that you treat as well? Yeah.
Yeah. So, so I'm seeing there's some variability in terms of how long it can take for psychotic symptoms to dissipate. Both of these case studies, it happened pretty quickly. That's not everyone in my work. Sometimes it can take quite a few months, and a lot of consistency. So both of these case studies were quick in terms of that piece. And then I wasn't surprised by the kind of improvement in mood. So the mood aspect, the mood symptoms that we see in schizoaffective disorder, you could really kind of see those improve over time and get better and better and better until we had, very low or remission recovery worthy scores by the end. And so, yeah, I'm not too surprised. I mean, again, these are case studies. This doesn't mean that these outcomes are going to automatically apply to you in the same way or rate. But it's not too unusual for people who do this work to see that kind of cadence in recovery.
Yeah. So I think some people maybe see case reports or case studies as, more anecdotal and maybe don't give as much merit to that or credence to that. Can you talk a bit more about why they are valuable, or why they are still valuable for advancing research, and how they kind of fit into that process?
Yeah, so I know that there's a lot of people that really talk about RCTs, randomized controlled trials. and that those are the gold standard, and we don't know anything and we can't say anything until we have those type of thing. And I get that. That is a very hardcore level of evidence that can be generalized, and it is important for evidence-based practice. But I think what people who are very, very into or diligent about RCTs is that they don't kind of understand that RCTs are up higher on an evidence pyramid. So an evidence-based practice really relies on a pyramid of evidence. And RCTs are up there as a higher level of evidence for sure, but you can't just have it floating up there without all the support underneath that helps inform the study within that RCT. So at the base are things like expert opinions and mechanistic theories, like, what do we think is going on here, or why might this work? And these are hypotheses, but they start the conversation going. They're not considered proof. And then up above that are things like case reports and case series. And these are useful because these are detailed observations about how treatments work in individual patients. And these are documentation of early signals of efficacy, safety, feasibility. And so above that, of course, is cohort studies and RCTs and broader populations and randomization. And then, of course, on even above RCTs, right, are systematic reviews and meta-analysis. So even RCTs, as much as people talk about that, that's kind of not the top, but the RCTs inform those. And so, of course, we have to have a base of evidence-based practice. And so I'm not a researcher, an academic researcher at a big institution or anything. So this is my contribution to metabolic psychiatry, is to do the extra work to write up these case studies and these case series. And I just kind of think, oh, I'm putting these in place to build the base of the evidence, and doing it for different diagnoses, not just bipolar disorder, schizoaffective disorder, schizophrenia. We're seeing really beautiful recoveries in all kinds of diagnosis. And so there's a lot of pyramids that I can help do my small part to kind of fill in that base and encourage the conversation that needs to happen to make this treatment accessible to people.
Yeah. So it's a great kind of building block in the process of figuring out if there is a valid place for ketogenic therapy in psychiatric care. I think another really cool thing that about case studies is it does create more space for the qualitative data and the actual patient experience.
Yeah.
I feel like a part of this experience over the last year for me has been kind of moving away from an understanding of my illness that is very based in the medical model of diagnosis and that sort of thing, and more into what is my experience of my quality of life. And I think that that's kind of a cool way to capture that transformation that is involved in this therapeutic process too.
Yeah. Yeah. I've been really interested and really excited in watching people recover, and the process by which they do that, and all of that. So I actually have a qualitative study that I'm working on right now that looks at that in more detail.
So I think that's the one that I was wanting to move into, talking about your ongoing case series, the bigger case series that you are currently in the process of conducting. So is it you're looking to collect 50 case reports or cases for this study?
Yeah. So it's yes, that's my goal. So these are interviews from individuals who self-identify as recovered or in the process of recovering due to the use of a ketogenic diet. And I'm collecting interviews from those individuals and, when available, family members who have also witnessed and seen this recovery process. And so I'm doing a qualitative study to kind of look into that a little bit more carefully. And it's also really helpful because, well, it's a little bit of a barrier. because I've got a pretty stringent pre-qualification criteria, which is somewhere in individuals' past that have mental illness. It's very likely that they have received some kind of mood assessment, whether it's a PHQ-9 or, a Yale-Brown assessment for OCD symptoms or something that's relevant to the diagnosis that was taken. And so I'm looking for individuals who have shown at least a 50% improvement in standardized mood assessments as a pre-qualification criteria. And then that's just to kind of pre-qualify the individuals that are coming into the study. And so yeah, it's amazing. So I want 50 because I'm actually creating a data bank of these interviews that other qualitative researchers can use for their own research and to ask their own research questions with. And in the field of clinical psychology, qualitative research is actually very valuable. And it's not considered a lesser thing necessarily. And so we really get a lot of clinical value as psychotherapists looking at these types of studies.
That's really exciting. So how can people participate if they have experience using ketogenic therapy for their mental health and want to be a part of this?
Yeah, so they would just go to my website, mentalhealthketo.com, and right up at the top, there's a link to ketogenic diet, mental illness, recovery study, recruitment. Tried to make it easy to find. And they can go down the page and make sure they meet the eligibility criteria. So they have to be 18 years or older. But I can also accept adolescents with signed parental consent. They have to have been using a ketogenic diet as part of treatment for their mental illness, have those kind of baseline scores, and then a follow-up score showing an improvement that's 50% or higher. I also am looking for people who are stable in their use of the ketogenic diet and not currently kind of receiving regular consultation around it. They need to kind of know what they're doing and have it be stable, not fiddling with it, right? Trying to get ketones to a different level. Self-reported confirmation of ketone levels at some time. So just, you checked and made sure you were actually making ketones on your ketogenic diet. And then actually having a diagnosis that's already part of the DSM-5. So sometimes people identify symptoms and those start to be referred to almost as their own diagnosis. So if that's the case, that wouldn't be a good fit for this study. And then they have to be physically present in the United States at the time of participation. That's part of my IRB.
All right, cool. Well, we'll link to that where they can find out more and reach out to you in the description of this video, as well as a pinned comment too. So I guess kind of looking more at the body of research that this is contributing to, what else or what needs to happen for ketogenic metabolic therapies to become more widely accepted as a psychiatric treatment?
Well, I think it's already happening, right? So we have RCTs kind of happening now. That data is being collected. I think everything is coming together. Like we talked about how people can pull treatment teams together. I don't think anybody has to wait for the perfect RCT or the prescriber or the medical doctor that is completely perfectly trained in ketogenic metabolic therapies and the effects that has on metabolism and brain health and all that. I mean, they're out there for sure, and more are getting trained. And so maybe that's a big thing that needs to happen, is more training for prescribers. And there's, Metabolic Mind is working on all of these different pieces that need to come together to make this an accessible treatment for people. I think that there are people to which treatment teams are not the best choice. I think there are going to be people where some kind of inpatient option is the best option, or part of a very closely knit medical kind of system within a medical system, a particular hospital system or a particular clinic system where they have a treatment team ready to go, already working together and talking with one another, might be the very best pick for a lot of different people, different situations. So I'm just silly optimistic about it. I think that it's just kind of inevitable that, people are going to want access to this treatment, and the studies are being done. And, I get to hang with a lot of the researchers that do these studies at different events and for different purposes. And I just want your listeners, your people who watch your channel, to really understand that just the most brilliant cream of the crop people are just, these researchers are just amazing that are working on this. So I sleep well at night knowing that this is inevitable.
Yeah, it really is exciting seeing all the pieces coming together that are moving this into more mainstream practice. And you kind of mentioned how, your team doesn't need to be perfectly trained in it to be able to still navigate this. But I think that there are some people, unfortunately, who are still coming up against skepticism from their care team, from their doctors. And so I guess if you could talk to someone who's watching this, who's maybe interested in trying keto or metabolic therapies, but is facing this skepticism from their doctors, what is your advice to them on how to navigate that?
There's a couple of things going on here. So one is you've got people with mental illness who are seeking treatment, for which other treatments have not worked in the past, and they would like access to other treatment modalities that have some evidence base. And ketogenic diet, it's getting a pretty hefty evidence base in terms of that pyramid, at least for some of the different diagnoses that people seek this out for. So, there's a couple of things going on. I think that's really invalidating for people, and I think that's really hard. And I work with a lot of people who have a lot of there's a lot of emotional processing that goes on when they go to their prescriber or they go to their medical provider and they bring this up. Now, some medical providers, like you've documented on your channel, are just like, yeah, let's do this thing, right? Whatever, because they really don't understand the ketogenic diet and its effects. They just kind of think you're doing some diet that's going to improve your nutritional composition and help your brain work better, right? Like maybe they think a vegan would do that well, or a Mediterranean, and they just really kind of don't understand what they're agreeing to even. But then, there's other prescribers and other medical prescribers that will actively discourage and spread misinformation about ketogenic diets that are not based on anything in the research literature. It's very easy for, nutrition and what we eat and how we eat is deeply, deeply personal. And each medical practitioner, they're really at risk for leaking, I guess is the best way to say it. They will leak their own kind of belief system around food and nutrition and fuels, like what fuels your brain or what doesn't. And it's not based on any kind of evidence. It's based on, well, this works for me, or this is based on epidemiological studies. And so they're really discouraging people away from this. And also, you're going to die of a heart attack. You're going to get a stroke. There's a lot of cardiovascular warnings going on. I've heard of psychotherapists, for example, telling people not to do ketogenic diets because it's going to give them an eating disorder, or it's been shown to cause poor mental health, which, oh my goodness, I'm very familiar with the research literature. That's just not there. So it's really hard. And then the medical establishment is an authority. And if you are already feeling unempowered as a patient, this can be really hard. So I say, please don't wait for your recovery. Please don't seek validation from a medical provider and put your own potential recovery and quality of life on hold, using all of your precious, beautiful life force trying to wrestle with a prescriber or a medical professional around this. There are open medical professionals who will support you to the extent they can, that that won't necessarily discourage you or give you non-evidence-based recommendations based on their own biases that aren't necessarily supported by the literature. So I find, like I say, sometimes just having one ketogenic informed clinician doesn't necessarily mean that they're going to run around spending their time wrestling with your prescriber for you. I've had many requests for that, and that's not how I use my energy best with my people that I do consultation with. It's how do we flow around this obstacle? How do we find a better option for you in terms of having someone who's going to help you with this? And so, sorry, I went on a rant there. I'm not sure if I answered your question very well, but
Yeah, I think it's a complicated thing. And I appreciate the insight you gave into the concept of people's individual preferences, beliefs, ideologies leaking into their understandings of this, and then subsequently how they show up in terms of providing medical care. And I think I've really learned that more pronouncedly over the last year, that, our understandings of mental health are so enmeshed with our own personal identities and understandings of who we are, and we're all human. And so obviously that is going to get really messy when we're asking or trying to move through a big change or shift, really a paradigm shift in how we understand these things. And so, I think giving a little bit of grace for everyone who is navigating this, patients, clinicians, and understanding that, you deserve to give it a go. And if your care provider can't get on board with helping you that, it's okay to seek someone else out who may be more willing to explore it with you.
Yeah. Absolutely.
All right. Well, are there any final thoughts or any key takeaways you want people who are listening to remember from this conversation?
Yeah. Well, let's see. I think that yes, actually, thank you for asking that. I want to say that the brain that you start your ketogenic diet with might not be the brain that you maintain your ketogenic diet with. So one of the big things, one of the main conversations I have with people when they very start working with me is they're really fearful that, they've got a lot of side effects. They have a lot of cognitive impairment, or they have a lot of issues with taking care of themselves. So the idea of needing to cook meals or maybe not having support people is really kind of scary for them. And they're concerned that they're not going to be able to necessarily do the diet or maintain the diet, And it's important to know that we have, tricks of the trade, right, to kind of help people who don't have a lot of support, who aren't functioning very well, kind of get into ketosis. And the reason for that is because once we kind of get them into ketosis, many people will experience improvements in energy. They can think a little better. They can plan a little better, even early on, potentially. And they're actually kind of able to maintain it a little bit easier. And so, that's important. That's important to know. The level of impairment that you're currently experiencing may very likely not be what you're trying to maintain your ketogenic diet with later. And that's what I see. So that reassures them often when I tell them, you're going to have a very different, you might have a very different brain in 2 weeks, 3 weeks, a month, 3 months, 6 months. I think you can probably attest to that.
Very much so. I didn't even consider that as a potential outcome of this. I thought at best my symptoms, like the psychosis, mood symptoms, those sorts of things would improve, best case scenario. But it went far beyond eliminating those things to really improving my cognitive functioning. And that was something I had just come to a place of basically resignation, that it was never going to be what I hoped for or wanted it to be or knew it had been in the past. And that was really hard to come to terms with. And so it's been an incredible gift. And you're right, has really improved the way I'm able to show up in my life and for myself and, with these therapeutic interventions in a way that I did not think possible. So I think that's really great encouragement to provide for people who may be thinking that it's just too much to ask. in terms of understanding that it could potentially actually increase their capacity in the process too, to a point where it's not too much.
Yeah, absolutely.
Well, thank you so much, Nicole, for coming to talk with us about your case study. Would love to pick your brain about future or further things around implementing ketogenic therapy and metabolic therapies as well, because you have been just the best resource for me over the last year, and you have so much incredible information to share. So I would love to continue talking to you in future videos too. But thank you very much again.
Yeah, thank you. I'll come on anytime.
All right. So once more, thank you so much, Nicole, for joining us to share more about this case report and ongoing developments in metabolic psychiatry. If you want to see more of Nicole's research and publications, we have provided links to those in the description below. You can also check out her website, mentalhealthketo.com, to learn more about all of her work, including her individual private consultation practice as well. We also have a direct link below to the case report that was just published that we talked about in this video, as well as the link to find out more about how to participate in her study on ketogenic diets and mental illness recovery. Thank you so much, Nicole, and thank you to each of you who watched this video. If you enjoyed it, please give it a thumbs up and make sure to subscribe to our channel if you haven't already, so as not to miss anything in the future. As always, wishing you and your loved ones good health. We'll see you in the next video. Bye.